Link on Wish TV is brought to you by the Business Equity and Opportunity Show.
Thank you for joining us for this week's Community Link. I'm Carolene Mays. A catalyst to support health-related projects and organizations that serve Indiana's most vulnerable citizens, the Health Foundation of Greater Indianapolis champions the health and well-being of those in need. Ebony Barney joins us today to tell us more about their work. Thank you for being here, Ebony. I'm so glad to see you. So tell us about the history of the Health Foundation. Why was it formed?
Thank you so much for having me. So the Health Foundation was formed in 1985 out of the sale of Metro Health, an HMO, and has had a history in school-based health and child health initiatives, but for the most part we have focused on HIV initiatives around the state of Indiana.
Could I ask, have health concerns changed through the years?
Oh,
and has the organization changed its focus at all?
Yes, absolutely. You know, one thing I have to first acknowledge, in the 1980s and 1990s, there was a lot of work done to lay a really solid foundation in HIV/AIDS, and a lot of that work we're still referencing today in HIV, and we were even able to utilize during the COVID pandemic and in other areas of public health, and will continue to utilize in other areas of public health. But one of the things that I enjoy the most now is being able to invest in the next generation of public health leaders, and so we're able to do that now through Public Health AmeriCorps. And so each year we're able to invite a group of new leaders in who we place at agencies throughout the state of Indiana, and they're focused on HIV, hepatitis C, and harm reduction. They're all on this personal and professional journey where they're learning not only to better prepare themselves for their career, but to work together. They're learning how to, complete a long-term project together. They're learning how to do things differently than how we've done them in the past. And so we're honoring the past, we're doing things differently, we're learning how to move forward together. So I may have had a really great idea, last year as someone who's been working in public health, but I also sometimes need to be ready to sit down and make space for the next generation. And
what does the next generation of health leaders look like?
Well, our team, a lot of times it means it's social workers, public health, doctors, but it also means that sometimes that it's a person with a high school diploma or a GED and a person with lived experience. It might be a person who's in recovery and has a passion to serve, and we can give them the training and just the opportunity to get that training and provide the space to do the work.
Thank you for doing that and working with these young leaders. In our last 15 seconds, tell us about the impact of the THF support.
Over the years, we have invested nearly $70 million in grants, but I think the most meaningful investment has been through the next generation of public health leaders.
Love
for sure.
That. So important, building a legacy. We appreciate you. Thank you for joining us for this week's Community Link. To share this story or learn more, head to wishtv.com, and we'll see you next week.